This is our second speaker series of the month. My name is Erin Pellegrin. I lead our UFH Connect video library along with Sue Weldon, who will be tuning in to listen this evening but won't be joining me. However, I have the amazing Kristen Vernisi joining me from our wellness team. So certainly, if you have any questions about our wellness program or sharing it with others with whom we may support, feel free to connect with her while we are together this evening. So, we've got a few states already. I'm tuning in from Philadelphia. We're here sort of around the East Coast area, but excited to see everyone from around the country. Our speaker series tonight is all about cardiorespiratory fitness and cancer. So again, new topic, really excited to have an expert in this space talking about the benefit of movement, exercise, working with an expert, and how that can protect your heart health long-term. I know that is something that our dietitian team is always talking about from a nutrition perspective. So now let's dive a little bit and learn more about how fitness can serve that as well. Before I go on, I do want to, there we go, just thank our education sponsors because, like I said, we've had quite an active month so far with education events for September, and we are so grateful for their ongoing support. So this evening's speaker series is presented through UFH Connect by our sponsors West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from our supporting sponsors, AbbVie, Tercera Therapeutics, and Veristem Oncology. So we are forever grateful for their ongoing support regarding bringing topics and discussions and experts of a variety of topics to our Unite for Her community. So we are so grateful for them. A couple housekeeping items that we have. Again, feel free to use the chat. Our speaker this evening will be going through her presentation. You're welcome to put some questions or comments in the chat as we move along, and know that we will be getting through all of them once she is done with her slides. We'll have plenty of time to move through and answer some questions. Earlier today, if you didn't catch live on our Facebook page, we had a wonderful Ask the Expert segment with Natalie Ledesma. She is a registered dietitian out in San Francisco. We talked all about supplements and cancer, so you can catch that recording in our UFH Connect video library. And then tonight we are recording our cardiorespiratory fitness. And then next week we have another Ask the Experts segment. And this is something special that we like to do when we partner other organizations in the patient advocacy space. And so we know September is Ovarian Cancer Awareness Month. So next Thursday, the 25th at 1 p.m. Eastern, we will be streaming live once again, and I will be joined by our partners from Okra. And we'll be hearing more about the incredible work that they do for the ovarian community and how those patients can get connected with them to take advantage of the services and resources and education and experts that they provide as well. So really excited to chat along with our friends at Okra. Again, that's next Thursday, the 25th, 1 p.m. Eastern time, streaming live to our Facebook page, all of which will be on our UFH Connect video library. We'll put the link to our chat, to that link in our chat shortly, in just a moment. So with that, I think it's a good time. We have a great turnout. I think it's a good time to introduce our speaker this evening. I am very, very excited to share the background of Nickie Griesemer. So Nickie is a board-certified physical therapist with a doctorate in physical therapy from Ithaca College. She is a certified oncology rehabilitation therapist through PORI, which is the Physiological Oncology Rehabilitation Institute, with a focus on chemotoxicity and exercise management. She's also a lymphedema specialist and a pelvic health specialist at Penn Medicine, Doylestown Hospital. Her focus with cancer rehab is addressing the side effects that occur from chemotherapy, including training the cardiorespiratory system, reducing the severity of neuropathy, and improving musculoskeletal strength for patients before, during, and after cancer treatment. She's currently studying to become a board-certified oncology specialist in physical therapy through the American Physical Therapy Association. Now, fun fact, and I cannot wait to share, She has been involved with Unite for Her since our very first Pink Invitational, which is our gymnastics invitational we hold every spring. And she competed as a gymnast. Since then, she's been working with Unite for Her as a student athlete, helping to organize pink meets both in high school and college. So, truly coming full circle, it is my pleasure to welcome our expert tonight, Nickie Griesemer. Nickie, thank you so much for being here.
Of course. Thank you so much for having me. That was an incredible introduction. Thank you.
You're
Um,
welcome.
it's so fun to be here in a professional manner, having the history with Unite for Her that I do. I really think Sue's story is what got me into a lot of the work that I'm doing right now. As a young gymnast at the time, I watched her go through her cancer diagnosis and watched her kind of fight through that. And then not only that, but also to create the program that this is. So she was really inspiring to me at such a young age, and it's so fun to be here in a professional way right now. So thank you so much for having me. Like Erin said, I'm a physical therapist with Doylestown Hospital, Penn Medicine, and we see a bunch of different patients with cancer on all different kinds of treatment trajectories. So I'm one of four oncology trained PTs at my location, which I'm very fortunate to be a part of. And we see people even before treatment starts to get them started on an exercise routine. We'll see them after or during chemotherapy to help with like neuropathy, the things that Erin already said. We might see people after surgery for lymphedema. We address pelvic health concerns. We might see people even 5 to 10 years or even more afterwards if they develop some late side effects. So it's fun to be able to treat people at all different parts of their diagnosis and to help them through in the best way that we can. So something more we've been doing recently is cardiovascular fitness, cardiorespiratory fitness, and seeing how exercise can help to mitigate some of those side effects and try to protect our cardiovascular system. So I'm going to talk about that today. So I'm just going to share my screen and pull up my slides. All right. Okay, can everybody see my screen? Are we
It
good?
looks
Perfect.
great.
Awesome. And I do see a couple familiar faces. So, hi, friends that I've seen before that are here today. Thank you for your support. I will see you guys later. So, today we're going to talk about cardiorespiratory fitness and cancer and how these things can help, how fitness in general can really help with your cancer journey, can help to improve your tolerance to treatment. And then, what are some exercise tips that you can actually do starting today or tomorrow to get your fitness on track? So first, we're going to talk about what is the cardiopulmonary system. So this includes our heart, our arteries, our veins, our lungs, and our diaphragm. And this system essentially is trying to get oxygen that we breathe in through the rest of our tissues. So if we take a deep breath in right now, we have a lot of oxygen coming into our lungs. The right side of our heart will pump blood to the lungs to get that oxygen. It will come back to the left side of the heart, and that left side, specifically the left ventricle, that's responsible for pumping blood to the rest of our body. And this is important because we need that oxygen in the blood to our brain, to our organs, to our muscles in order for us to be able to do all of the things that we need to do in our day to day. Cardiorespiratory fitness is the ability of our heart, our lungs, and our circulatory system, so the veins and the arteries, to deliver oxygen to those muscles during physical activity. This is also called your VO2 max or VO2 peak. VO2 stands for the volume of oxygen consumption, so how well we get that oxygen in and transport it to the body. When we talk about fitness, we've all been doing an activity and maybe we hit our max point where we can't go any further and we have to stop and we have to rest. That's kind of where that fitness level is, how well we can do that oxygen exchange, get oxygen to the tissues before we just can't continue anymore. When we talk about, and this is important because they've actually done studies that show the better our fitness is, the better we can tolerate treatment, the better we can go through treatment, and the better outcomes that we have. So, talking about cardiovascular disease in general, it's actually the number is very, very prevalent, number one prevalent disease, not only in the United States, but also in the world. And it is the leading cause of mortality in the United States. Actually, 1 in 20 adults aged 20 or older are diagnosed with cardiovascular disease at some point. So, it's really important that we work on our cardiovascular systems, try to reduce that prevalence. There are a lot of risk factors that contribute to both cardiovascular disease and breast cancer, and also ovarian cancer. I'll share those a little bit later on. And we kind of separate them into modifiable risk factors versus non-modifiable risk factors. The ones on the right side of the screen that you'll see, those are more of our modifiable risk factors. So hypertension, diabetes, obesity, smoking, unhealthy foods, hyperlipidemia. Also highlight physical inactivity. That's what we're talking about most today. These are things that we can change. On the other side are things we can't change, those non-modifiable risk factors, socioeconomic, healthy or access to healthy foods, those things we can't always change. So we want to try to focus on the things that we can change to reduce our overall risk for cardiovascular disease and for breast cancer. We have a lot of awesome treatment options out there to help fight the cancer. We're getting new discoveries all the time. Primarily immunotherapies lately have gotten a big boost. There's lots of different treatments, and they are important. They are life-saving treatments. But as everybody on this call knows, they do come with different side effects. And so for pretty much all of these, one of the side effects is cardiotoxicity or cardiovascular disease. So we'll kind of go through some of those and how they have that impact on the system. So we talked about some risk factors already. In terms of cancer-related risk factors, the main medications that are the most cardiotoxic are going to be anthracycline treatment. That's your adriamycin, doxorubicin group. We sometimes refer to them as the Red Devil if you've seen that. That's that anthracycline group, and they have been found to be a little more cardiotoxic. Radiation to the left wall, that's where our heart lives on the left side. So radiation to that area also puts us at a little bit more risk. And then prior trastuzumab or Herceptin, that's one that we're on for about a year. That's more targeted treatment versus anthracyclines are more systemic. That one's also been found to be more heart toxic. And then the other risk factors, we talked about those cardiovascular risk factors already, bolded sedentary lifestyle again, because we're working on exercise. But also, if you already have cardiovascular disease going into your cancer diagnosis, that's going to be something that's important to consider. So if you have coronary artery disease or hypertension already, then we want to let our doctors know because that might put you a little bit more at risk once you go through the treatments. Also, age is something to consider. The older we are, the more likely we are to have cardiovascular disease, and it's the same concept when we're getting these chemotherapy medications. Ooh. Okay, so then for a couple statistics, there's an article came out in 2023 looking at the overall risk of mortality. And so breast cancer is still the number one, but number two is cardiovascular disease. So we're seeing a really high prevalence of cardiovascular disease among cancer patients. And that's the second leading cause of mortality. Usually, if we're going to have cardiovascular issues, it often happens soon or during we get chemotherapy. So a lot of the doctors are monitoring for different testing that we'll go over in a little bit. But it can develop maybe even 20 years after treatment is over. So it's something that we want to be mindful of. And the more we reduce those risk factors, the less likely we are to have some of those late side effects later. The main ones are anthracyclines and Herceptin, like I mentioned before. And also combination treatment. So combination is when you're having an anthracycline combined with endocrine therapy and immunotherapy. Most people are getting multiple options to try to fight the cancer as best as possible. That does increase our risk a little bit. And there are some studies showing that cardiovascular disease is more prevalent in ovarian cancer as well. It's just not quite as well studied, so we don't have as specific statistics. So that combination treatment that I mentioned, this article looked at the relative risk of cardiotoxicity for a number of different chemotherapies, and you can see that each one is relatively low, but when you add them up together, that's when we start to see a little bit more of that risk. Radiation, just to highlight, I did mention the left side is where we have the most risk. But this article that came out in 2021 highlighted radiation anywhere in the body. This is important for pelvic cancers, can increase a little bit of demand on the cardiovascular system. It mainly does this by causing some narrowing of our blood vessels. And so if those are narrow or atherosclerosis, it's going to increase some of the resistance through the system and put a little bit more strain on the heart. The risk is relatively low with radiation, but it's just something to consider. And then just a note on endocrine therapies. So, this is one that we don't often think about having an impact on the cardiovascular system, but estrogen tends to be pretty protective of our cardiovascular system. And we're still studying this a little bit more. But they did a nice study just a year ago, 2024, that looked at the difference between people who are on tamoxifen versus people who are on an aromatase inhibitor like letrozole combined with ovarian suppression. And that could be an oophorectomy, so removal of the ovaries, or different medications like Lupron that suppress the ovarian production of hormones. And they found that the aromatase inhibitor combined with ovarian suppression actually increased your risk by twofold of having cardiovascular issues. So if you're getting, which many patients are on endocrine therapies, it's really good to have these conversations with your doctors just to kind of look at overall long-term risk. And then this article, it was funny. Dr. Shaheen has been on literally last week that I saw, and he gave a presentation at our hospital this morning from part of our cardio-oncology committee that we have. And he talked about this particular article and went through a lot of the different treatments that have a side effect on the cardiovascular system. And some of the things to highlight from this article is premature menopause, so less than 40, does increase our risk of coronary artery disease, and that bilateral oophorectomy, so both sides being taken out before 50, also increases that risk. And then we have those same risk factors. So we're looking at lack of exercise, obesity, smoking, diabetes, high blood pressure, hyperlipidemia. All those things are really important to consider for gynecological cancers as well. And then just a little note at the bottom, they did have two paragraphs in this article that talked about the benefits of exercise, and we should be using that to try to target some of those modifiable risk factors. And all of that. So I just want to take a moment, have everyone take a deep breath. It was a lot of information. It was a couple articles that have a lot of detail and a lot of scary things about the cardiovascular system. Not everybody's going to have cardiac side effects. So I want everyone to just kind of take a moment and realize that it is okay. These are options. It might happen, but it's not happening to every single person. Many patients who do have cardiac issues, they can spontaneously resolve on their own. So it's something to talk to your doctors about and to continue to monitor, but we can do all this exercise for it and eat healthy. Don't over freak out about it. My goal here is really just to provide education to promote those lifestyle changes, right? We want to use exercise to try to reduce risk. I want to give you that background information so you understand that we're aware of why this is important and why we want to talk about it. But knowledge is power, right? And exercise is one of the few things you can actually control. So you can use exercise as a tool to help your oncologist fight the cancer. This is something you have power over. Okay, so what are doctors doing about it? We have all the data on why this is important. They have really changed a lot of their treatment approaches over time. So anthracyclines in particular have been around for quite a while. And they have really limited the dose to figure out what is still effective for the cancer, but what is also going to provide the less impact on the cardiovascular system. They've also changed radiation techniques. And some people here might be familiar with the breath holding techniques that they're doing. So we're expanding the rib cage, trying to create space from the heart so the radiation doesn't hit that area as much. And then I just want to point out here, aerobic exercise is listed under anthracycline. So in these articles, in the research, it's starting to be promoted a little bit more. They're also using different blood pressure medications, different meds that they have at their disposal that's been found to help to reduce that risk. Also on this side, we talk about testing. So they do echocardiograms and EKGs to monitor the structure of the heart. They're looking at the rhythms of the heart just to see what those baseline measures are. I know at our hospital for anthracycline use, we'll typically do echoes and testing before, and they'll do it again after, and they'll see our cardio-oncology team maybe repeat the testing every 6 months or a year, kind of moving forward. For Herceptin, since we're on that for a lot longer, they'll often do this every 3 months during treatment to monitor a little more closely. And then they'll do it less often as you're out of treatment every 6 months, 1 year, kind of go through. Every system's going to be a little bit different. If you're getting some of these more heart toxic medications and you haven't had echoes or you haven't had the testing done, you are your own best advocate. So just ask your doctors about it. Make sure they know you're thinking about your cardiovascular system and kind of inquire, what are we doing to monitor the system throughout treatment? The concept of cardio-oncology is relatively new as well. So our program started only about 5 years ago, and it's a pretty robust program now, but they don't have it all over the place. So cardio-oncologists are typically a cardiologist who has more training in the effects of chemotherapy on the cardiovascular system. So they're trained to know what to look for, what to monitor for, what to let you know to look for. They might be really great if you're getting one of those specific cardiotoxic medications, but you don't necessarily need to see one. It depends on kind of talking with your medical team. Sometimes your own cardiologist might be good and they have additional knowledge or can do research, especially if you don't have one in your area. And then I know our cardio-oncology team is trying to train our primary cares in the area to give them more knowledge so that they can understand what to look for and how to help treat. I did include a link at the bottom here. So the International Cardio-Oncology Society has a database of their cardio-oncologists. So if you're curious to see if there's anyone near you, you can do a little research. You can look that up and see if someone's there. Also asking your team, right? Ask your medical oncologist, your current cardiologist or primary care, should I be seeing a cardio-oncologist? Do you know of anybody in this area? Okay, so that's what all the doctors are doing to try to help reduce cardiotoxicity and some of the options we have. But I'm here to say, what can you do for your own system? And really, it starts with those modifiable risk factors. Can we reduce your blood pressure, reduce cholesterol, try to reduce stress and eat healthy? Unite for Health's got a great program for nutrition that Erin runs. So they've got tons and tons of stuff for you for a lot of these modifiable risk factors. And exercise is one of them. They did a good study in 2023 that looked at the effects of exercise in a non-cancer setting on the cardiovascular system. And they found some really great results. There was an improvement in life expectancy, an improved response to insulin in the body, helping to reduce diabetes, decrease in high blood pressure, improvements in cholesterol levels, and reduction in coronary artery disease by reducing plaque buildup, and even a reduction in heart failure. So they reduced heart failure hospitalizations they found in this study. So exercise can be super beneficial in the whole system. When we talk about cancer specifically, there's actually been some great articles coming out that exercise can help fight cancer itself. It reduces the treatment-related adverse effects. It can enhance curative effects of cancer treatments, reduce your overall risk for cancer. And they're finding that it's doing this by reducing the ability of the cancer cell to reproduce and proliferate, and it induces death of the cancer cell. It also helps to improve the immune environment that our body has to help fight the cancer. So these studies are coming out that are both in animal models and human models, really looking at how does it affect the tumor at like a microvascular level, and how can we use exercise during our chemotherapy treatments and post-surgery and radiation to improve the efficacy of those treatments. So really exciting stuff coming out that's pretty new. When we talk about cardiotoxicity specifically for exercise, we still have a lot more research that needs to be done in this area. So we do know that VO2 peak, that cardiorespiratory fitness, that peak volume of oxygen consumption, that can be improved significantly with exercise, and it helps reduce the side effects, specifically on the heart. But we're not quite sure about some of the structural changes yet. So LVEF, that's listed in the middle column there, that's left ventricular ejection fraction. That's that left ventricle, how well it can pump blood to the rest of the body. Some studies have shown potential changes in that with exercises. Other studies have not shown a significant change. So we still have a lot more research to do on whether it can actually reverse or prevent cardiotoxicity. But we do know that exercise in general can be really helpful for the whole system. So research is emerging. I'm going to share a couple specific studies on the benefits of exercise for breast cancer and ovarian cancer and a little extra bonus study. So, for breast cancer in particular, they did a great study where they had people exercise at specific numbers. That 9 med hours per week is it's a basically, I'll go through the guidelines later, but a sneak peek of 150 minutes of aerobic exercise per week. And they found that following these guidelines that I'm going to go through more specifically, found a 23% reduction in the risk of overall cardiovascular events compared with people who did not meet the guidelines. And then they found even better results in people who are over the age of 70. That was a 36% reduced risk of cardiovascular events. So, really great research here for breast cancer. For ovarian cancer, there's not as many studies. Again, they're coming out. One study in 2022 found that first, exercise was safe and effective. So, always good. We need to know our treatments are safe. And they also found that there was a significant improvement in cancer-related fatigue, which is a huge burden. It improved sleep quality, and it improved overall quality of life in these patients, which is huge. Yes, we want to fight the cancer and cure the cancer, but quality of life is just as important. So exercise was great there. And then there's a study that should be coming out soon. It's called the LIVE study. They published their methods in 2023, so we should be seeing the results in a little bit. They're looking at 2 years of an exercise intervention where they're doing a combination of aerobic and resistance, and then they're following these patients for 5 years. They're looking to see disease progression. Did it improve with exercise? And looking to see quality of life. So that's going to be a really important study that's coming out soon for this population in particular. This is a little bonus study, and I'm very excited about this study. So, it came out in 2025, and it was a landmark study in the exercise world. It is not breast and ovarian cancer, it was colon cancer, but it is huge, and we're trying to extrapolate this and start to research this kind of method with a lot of our other cancer populations. So, I just wanted to share this with you since it was so exciting. So, first, the procedure, it was a randomized controlled trial. This means that there's two groups. So they had one group that was a control. They were given education. So that is, we want you to exercise. Here's what we want you to do. We want you to do it this many times per week, and we really think it'd be beneficial. So please do this exercise. And then the other group was more structured exercise. So they came in twice a week. They had a specific routine. They were followed by an exercise professional, and they recruited people for over 15 years, and they had them do the exercise for 3 years. It was a combination of in person and via Zoom, and they went through a lot of aerobic exercise. So they did brisk walking, and that was for 45 to 60 minutes, 3 to 4 times a week, or they did jogging 25 to 30 minutes, 3 to 4 times per week. The biggest thing about this study, and what I think made it the most effective, is they had mandatory behavior support sessions. So they had behavior health therapists come in and actually work with these patients on days they had in-person exercise sessions. If you're anything like me and we get to New Year's and we do our New Year's resolutions and we decide we're going to exercise, or for me, I'm not going to eat as many Reese's, the dark chocolate ones are great. And then I go for about a week and I'm really good. And then at the end, it kind of falls off. New Year's resolutions are so hard, right? So having the behavior support sessions was huge because exercise is hard to fit into our life. It's really hard to do a consistent routine. I'm sure everyone here has fallen off the wagon at some point when they try to exercise. So having those people to help fit it into their routine, understand why it's important, actually encourage them to do it consistently, I think really contributed to the outcomes. So the outcomes were a 28% reduction in relative risk of disease recurrence, which was huge, a 37% reduction in relative risk of mortality, and a reduction in secondary cancers. And this one's important because for colon cancer, a secondary cancer is often breast cancer. So they found a good reduction in all of these things just with exercise. They even found that it was as beneficial in terms of the percentages as some of the chemotherapies that they're using for colon cancer. They also found improvements in cardiorespiratory fitness and overall physical functioning over the 3 year period that they were exercising. So, exercise is not going to cure cancer, it's not going to fix it, but exercise combined with the chemotherapy, like this study, they had people come in who had completed chemotherapy about 6 months prior. Having that combination of exercise plus treatment is showing to be really, really beneficial. And we're trying to make it more of a first line defense when fighting cancer. You get the diagnosis, you have your plan of surgery, radiation, chemo. We're going to try to have you exercise at the same time because we're seeing some really beautiful benefits. Okay, so this study came out in 2022, and it was looking at exercise compared to functional decline. So this was a theoretical model for how exercise would likely be able to reduce disability. And it was based off a lot of other studies that look at the effect of exercise. So the first graph there is looking at people who exercise before treatment, and this was specific to anthracycline use, so the doxorubicin, adriamycin. So the first one was before treatment. The second one is looking at exercise during treatment. And the third one at the bottom is looking at exercise after treatment. And you can see on these graphs that people who exercised before had a higher fitness level. That blue line in the graph is exercise, the orange is no exercise, and that red line is disability threshold. So the blue line, they had a higher fitness level and it prevented some of that decline. We know that no matter what we do during chemotherapy, we're going to decline a little bit, but it's how do we prevent as much of a decline and how do we come back out of that a little bit faster? So we could prevent a little bit with a pre-treatment exercise. The second one, if they exercise during chemotherapy, we didn't quite get to that disability threshold. We didn't drop quite as low and we maintained that. And then the last one for people who exercise after, maybe we did drop down into the disability. It was just a lot of chemo for our body to handle. But exercise allowed us to get back out of that disability threshold where people who didn't exercise stayed in that level. So this is a really great model to look at how exercise is going to realistically help before, during, and after chemotherapy. So cardiorespiratory fitness, how do we measure it? There's a few different ways how we can figure out what our fitness level is, and it depends on who you're seeing. So cardiologists and researchers, they're going to look at something called a cardiopulmonary exercise test or a CPET, and they use gas analysis. So you're on a treadmill, you have something on your face that is gas analysis, and it's looking at how much oxygen you're getting to and from your lungs. And so they have you go till you hit your fatigue on the treadmill, and they're measuring when we don't have the oxygen there anymore, when we can't do that exchange as well. And so that's determining your VO2 max, your maximum volume of oxygen consumption. This is mostly seen in research now, and a lot of cardiologists don't have time to complete these in their clinics, so you're not going to see that as often. What we're doing on like a secondary level is something called a graded exercise test. So you're going to see this more with physical therapists or exercise physiologists that have training in this. And so we're using a treadmill, or it could be done walking, the 6-minute walk test I'll talk about. But we're using a treadmill, and every minute we're increasing the speed or the incline or both until we get to a point where you feel you can't continue anymore, or we're reaching your maximum heart rate, and I'm monitoring vitals and stuff. So it's an estimated VO2 max or a VO2 peak is what we're looking at with this one. A 6-minute walk test, not everyone is able to walk on the treadmill or they don't feel comfortable to do so. So we might do a 6-minute walk test instead, and that's looking at how far you can walk in 6 minutes. And both of these have different equations for me to determine what your fitness level is. Well, then in my clinic, we'll compare it to the people who have had cancer who are your age and what their fitness levels are. And there's different categories. And then we'll compare it to the general population, people your age who have not had cancer. So we kind of get a sense of where you're lining up no matter what point during the treatment regimen you're in for cancer treatment. And you can kind of look at your own VO2 peak. If you guys have any of these Apple Watches, I'm sorry for all the Android people out there. I'm going to reference Apple Watches and iPhones a lot, but you can look at all this the same way on those phones. I'm just not as familiar. I see the Apple Watch more in practice in general. But if you have an Apple Watch, it will tell you what your cardio fitness is if you kind of dig into the app on your phone a little bit. It isn't quite as accurate. So they did do research on it and they found it underestimates the VO2 max. So you can kind of look at it and see what yours is and maybe give yourself an extra couple points there and see since it's underestimating it. But this is a way you can look at it on your own. So how do we improve that VO2 peak? We're going to exercise. We're going to walk, we're going to jog, we're going to do whatever exercise that you enjoy the most to try to improve your fitness level. So those guidelines, how much should we be walking? What should our exercise routine look like? The American College of Sports Medicine, or ACSM, puts together guidelines and they update them every so many years. And so they have the guidelines for the average Americans and then specific for people who have gone through cancer. They are actually the same thing. We shouldn't be exercising any less, even though we have had a cancer diagnosis. So these guidelines are moderate intensity aerobic exercise, at least 150 to 300 minutes per week, or more vigorous intensity aerobic exercise, so 75 to 100 minutes per week of that, combined with at least 2 times a week of resistance training. As a physical therapist, I have to include another couple things that aren't necessarily on the guidelines. So, stretching flexibility, if anyone's had surgery, you know how important that is, and radiation. And then balance. Balance is huge, right? We have different chemos that affect our balance and neuropathy and all kinds of stuff we're not getting into today. But practicing your balance, I like to give a little bit of stretching, a little bit of balance daily, but obviously working with the person and what we can fit into our schedules. So I threw out some intensities, right? Moderate intensity, vigorous intensity. What does that look like? We can use a couple different things to measure our intensity. First is our heart rate. So the higher our heart rate is, typically the harder we're working at an activity. So the higher it is, the more intense the activity is. We use target heart rate in our clinic to prescribe that intensity of exercise. So you might come in to see me. I might have you do the treadmill test or the 6-minute walk test, and I'll look at what chemos you had, if you had any of those risk factors before your cancer diagnosis or currently. I will look at your strength and range of motion and all kinds of stuff you go through in PT. And then I will do some fancy math equations and I will determine where I want you to exercise at in terms of intensity. And I'll give you a target heart rate to exercise at. So I might say, I want you to exercise at 120 beats per minute for 20 to 30 minutes. It can be super specific to the individual, depending on the treatment that we do and the interests of the person and what I'm going to prescribe. But in order to use target heart rates, you should really have an exercise professional that can be that specific with you. So I can't tell everyone to exercise at 120 beats per minute because everyone's different in terms of their age where we should be exercising. I did include one equation at the bottom, so our maximum heart rate. We don't want to be exercising at or past our maximum heart rate. That's pretty high intensity. If you're going to be doing that, talk to your exercise professional or your medical team. But that's kind of our upper limit. So we use the equation 208 minus 0.7 times your age to determine what your maximum heart rate is. And that is where we don't want to be exceeding. And once we get towards that point on our treadmill test, that's my cue to stop the test. I do want to put a little disclaimer here. It's not uncommon for chemotherapy and some blood pressure medications to affect our heart rate. So heart rate isn't always the best measure for intensity for an exercise routine, depending on the person. Beta blockers in general, if you're on one of those, sometimes, depending on how much you're on, they can prevent your heart rate from rising with exercise. So we may not need to use, or we may not be able to use heart rate for intensity for that individual. So that's why it's nice to have an exercise professional. We can check for those things and make sure we're monitoring. Another way that I'm going to teach you is called the Rating of Perceived Exertion Scale, or RPE scale, combined with the talk test. So this is a very generalized scale, and you're basically pointing to a number and saying, I feel I'm working this hard. And this is a great way to determine how hard, moderate, vigorous, even low intensity, how hard you feel you're working. This is an example of that scale. So there's two different scales in one here. We have the 1 to 10 scale, and then we have our Borg scale that's 6 to 20. So 1 to 10 is very simple, easy to look at. I understand 5 in relation to 10, right? 10, we're all out sprinting. We can barely keep going. That's your max effort. 1 is very, very minimal effort. We could do this for hours, gentle stroll, right? Easy to go 1 to 10. The 6 to 20 scale, it's actually correlating with your heart rate. So you take the number and you multiply it by 10, and that's your estimated heart rate. That's been validated in research and can be pretty accurate. So if you tell me, oh, I think I'm working at a 3, more comfortable pace, or you tell me 11 on the scale, I'm going to assume ish your heart rate might be around 110 beats per minute, and that might be where I want it given some equations I do for target heart rate, even if I can't give you those target heart rates. So this might be a really good scale for you to use when you're doing your own exercise. You might say, I want to do the moderate intensity activity. I'm going to do 5 times a week for 30 minutes to get to that 150-minute mark on the low end. And moderate here in this case is going to be 3 to 5 on that scale, or 12 to 14. And so you're reading through that and saying, okay, I'm going to work at a 4 on this scale. So that's a great way for you to determine how hard you're working with an activity and how hard you want to work at. We do have some specific guidelines for oncology. So I mentioned, or Erin mentioned PORI, the Physiological Oncology Rehab Institute. Myself and 3 other coworkers were certified through this to become a center for excellence at our hospital. And so we have guidelines through this certification that we will utilize, and we kind of tailor it to the person. So this might be, let's say we're going through chemotherapy and you're feeling like, I don't want to exercise at a moderate intensity. I am exhausted. I can't do that. Or I'm definitely not running during. Every person's a little bit different. So these might be better guidelines for you that we've still found to be really effective. So the first one is if you're getting active systemic chemotherapy. Doesn't have to be heart toxic, could be Taxol, could be any of those systemic ones. We will generally say that RP of 1 to 3, so more of a low intensity. That would be maybe 6 to 12 on that scale. And what am my initial, let's say someone hasn't really exercised before, they're seeing me during chemo, but they're motivated, they want to exercise. I might say a low intensity for 20 to 30 minutes, 2 to 3 times a week. Or more with an exclamation point, because the more we do, typically the better we're going to feel. And then it's really just trying to have those cardio protective. We're getting our blood pumping, we're getting our body moving, but we're not overstraining our system with low intensity. I do want to point out that there have been more studies recently, though, looking at HIIT training. HIIT training is high intensity interval training. I'm going to go through that on the next slide. That's more vigorous intensity activity. They did do a study in Australia that looked at women getting anthracycline treatments, and they had them doing high intensity interval training during anthracycline chemotherapy. And they did find an improvement in VO2 peak by a significant amount. They didn't necessarily, though, show those functional declines or preventing those functional declines. So the low intensity might be super appropriate for some people. In the clinic, I've used low intensity and actually saw improvements in VO2 peak for people who really didn't exercise a ton before, but it depends on the person. So you might want to individualize it and tailor it to you. Post-surgical or during targeted would be Herceptin or immunotherapies or endocrine therapies we're on for a really long time, we can move more into that moderate intensity. So that'd be more 3 to 5 on that RPE scale. And we're working towards those guidelines. So 150 to 300 minutes per week. And we're trying to progressively improve our fitness and our tolerance to activity. In our clinic, we do every 3 months, we'll do another treadmill test, and then we'll improve on their target heart rates or progress their intensity as long as everything is moving in the right direction. So I might have someone exercises at that moderate intensity for 3 months, and then we'll retest. And if things are good, then I'm going to do more vigorous. So that's that 6 to 8 you see there. For long term, we go back to the guidelines. So 150 to 300 minutes per week moderate, or you could choose to work into that more vigorous space. So that might be a walk, run, that kind of situation. At this point, we want to continue to improve or maintain our fitness if our fitness is already pretty good. I also want to mention the 5-minute rule. I love the 5-minute rule. I use it all the time, especially during chemotherapy when we're feeling at our worst. When you feel terrible, you feel really fatigued, you're really tired, you're between chemo cycles, and the last thing that you want to do is exercise, I want you to try to walk for 5 minutes as long as you feel physically safe to do so. If you feel better after 5 minutes, keep going. You've actually created more energy in your body to help you get through your day. If you feel worse, your body's telling you it's time to rest. You can go lay down, you can sit, you can take a break. But the 5 minute rule is super helpful because I've had so many patients who start to walk for 5 minutes and then they feel better. And next thing you know, it's been 15 minutes and they've got a good walk in, even when they felt they weren't going to get off the couch. So, really great rule to go by. High intensity interval training. So moderate intensity, we pretty much get it's a brisk walk. We're trying to increase our heart rate, but we could still talk. Vigorous intensity might look like a HIIT training workout. And this could be as simple or as complicated as you want to make it. They're basically short intervals of intense workout, followed by intervals of more of an active rest or a recovery period. It is considered that vigorous intensity, so you get a little more bang for your buck. So that 75 to 150 minutes might be great for some people who don't have a ton of time during their day to exercise. This would be when I start this with some patients, I will start them with 1 minute of a light jog and then do 4 minutes and then repeat that 5 times or however much they can kind of do. And I might have them work within the target heart rates if I've prescribed this or within certain RPE levels. So I might have them do 1 minute and an RP of 7 to 8, and then an RPE of maybe 3 to 5 for the 4 minutes and repeat that several times. You can start to close that gap and do 2 minutes of a jog, 3 minutes of a walk. You can stick with the 1 minute and do even longer time period. It doesn't really matter. I've had patients even start with 15 to 30 seconds of a light jog and then do more of that moderate intensity, whatever feels good for you. You can also do this with strength exercises to get your heart rate up. So you could do 30 seconds of squats and just sit to stands from a chair. Just go for 30 seconds. I promise you're going to feel the burn. Some of my people who I know here have felt that burn. They've got it. And so then you rest for a couple seconds, maybe 10 to 20, and repeat it a few more times. You could do this with the steps. You could do lunges or jumping jacks. So just get in a little bit of that vigorous and alternate back and forth as that HIIT training. And then there's a kind of fun concept in the research called exercise snacks. And so this is when you get really tiny bouts of exercise in throughout your day. I have several patients who are going through cancer treatment, active chemo. They are working full time and they also have kids at home that are young and need their attention. This group is really hard to get them to exercise consistently because time is just non-existent. So for that group, an exercise snack might be great because you can, let's say we're working in between emails, you're gonna do a couple sit to stands, or you're going downstairs to get some lunch, go up and down the stairs a couple more times. Do these little tiny bits throughout your day. It will get your heart rate up, so it'll be more moderate to vigorous. It's only a couple minutes, and that adds up throughout the week to get to that 150. So maybe a couple days out of the week, you can do a longer walk, and then a few other days we just don't have time. Try to get some of those exercise snacks in. That can really go a long way. Okay, so just to make it a little more applicable with Apple Watch users, there are ways that you can track your exercise on your watch and you can look at your heart rate during activity. So if you do have an Apple Watch, that picture you see on the screen with the little green bubble with someone running in it, I call that the fitness buddy. You're gonna click him to start with, and then you can pick whatever exercise you're gonna do. And maybe it will be like walking, or they even have badminton on there, whatever you're interested in. And then you click start and it will track your heart rate. So you can look at it every once in a while to see what my heart rate is during this activity. And then there are two apps on the phone that you can look at that will hold this data and you can track it. So the first one is the health app. So if you go to browse at the bottom and then click heart, it'll show you your average resting heart rate, your average walking heart rate, and that's where it shows you the cardio fitness that we're not sure exactly how accurate it is. And you can see trends. So in my clinic, if people have this, I will go back to before their cancer diagnosis and I'll look at what their heart rate trends were and I'll see, did it spike up? Most likely it did with that diagnosis and with treatment. And as we initiate exercise, does it start to come back down? The fitness app is a the 3 ring app. Anyone who has a Apple Watch is familiar with this. You will see all your sessions, your exercise sessions recorded in this area. So it will show you what your heart rate did during your exercise routine. And you can even click that further and it'll show you more specifics. So it'll say at this point during your walk, your heart rate was the highest versus the lowest and what your trends were. So this is a great way to kind of track it on your own. Even if you're already exercising and not really being monitored, you can pick up on, is my heart rate maybe higher than I want it to be? Should I talk to my doctors about this? Just a great way to monitor and to track all those numbers. And then I have to talk about some safety considerations. So there are some criteria where we should not start exercising, or you really want to talk to your providers before you do start to exercise. So the blood pressure ones here is something I'm looking at more in my clinic. Most people aren't necessarily checking their blood pressures at home, but you can. And then resting heart rate is a big one. So if you're just sitting on the couch, you haven't barely even gotten out of bed, we're just at rest and it's over 100 beats per minute, I want you to check with your doctors, make sure we're not too elevated at a resting state. Same thing if it's less than 50, we want to be checking with our doctors. And then our oxygen saturation. So if anybody has a pulse ox that you put on your finger, that will show you what your oxygen levels are. If we're below 90, we're not getting that oxygen perfusion. And so we might have more of a risk of maybe being lightheaded or passing out. So we want to be mindful of those numbers. And then if you've got any symptoms of shortness of breath, mostly at rest, chest pain, dizziness, severe headache, sudden onset of numbness, weakness, or a severely painful calf, that could be a DVT or a blood clot in your calf. Those are reasons to talk to your doctor and hold off on exercise until we get clearance. And then we have pretty much the same things for criteria to stop exercise. So if you're exercising and you experiencing any of these things, you want to stop what you're doing and make sure you contact the doctors. So the big one here is your heart rate. If you have a sudden drop in your heart rate, so let's say we're exercising, you've been pretty good around 115 beats per minute, and all of a sudden it's dropping more than 15 beats per minute, and we haven't changed the intensity. You haven't slowed down quite a bit. And then maybe it's bouncing all over. So it's going really high, then really low. That could be an arrhythmia happening within the heart. So we want to make sure our healthcare providers know this if you're experiencing this. Also, if our heart rate exceeds our max, right? We mentioned that earlier. You don't want to go past that maximum heart rate. You don't need to be exercising at your max heart rate. So those are two good things. And then the oxygen is the same and the symptoms are the same. So just monitor those. It is good to get clearance from your healthcare providers if you have pre-existing cardiorespiratory or cardiovascular conditions, just to make sure that they know that you're exercising, we're monitoring things appropriately. Okay, so resources, there are, I mean, I'm a little bit biased, but physical therapists can really help you out in this area. We address a lot of functional deficits, like we kind of mentioned earlier, and we can give you a lot of guidance for when should you be exercising, given your history and what you're going on, what's going on with the treatment, how hard should you be exercising? Typically for PT, you do need a script or a referral from a doctor. Then I do want to mention not all PTs have the oncology training. So we went through extra courses to have a lot of this knowledge. Some PTs might be fantastic and do some research, but it is good to look for oncology specifically trained therapists so that they know what chemos you're getting, what effects they have on the different body systems. And then there's lots of other resources. So if you're independent, you don't have functional deficits, you don't think you need PT, you've got exercise down, but you want a little more guidance, the Thrive program at the YMCA is great. Not all Ys have them, but many do. It's 2 times a week for 6 weeks, and you get that personal trainer. It's a group setting, so you meet other people. They can be great. Also, Unite for Her Partners with Stronger Through Cancer. I love them. They're fantastic. You get more of that kind of one-on-one virtually. It's great. You can do your own independent routine, and then it is good. If you're worried about it, you're not sure how you should be exercising, get some clearance from your oncologist just to say, we're okay with you exercising, you're good to go. Oh, and there's Unite for Her. They have lots of resources. Okay, and I'm just going to wrap up with a few more things. The American Heart Association has something called Life's Essential Eight. So there are 8 things that are essential components of cardiovascular health. Healthy diet, Unite for Her has totally got you there. Participation in physical activity, we just went over a bunch of things that you can try. Avoidance of nicotine, getting healthy sleep, maintaining a healthy weight, having good levels of blood lipids, a good blood glucose and blood pressure, all those modifiable risk factors we talked about before, those are really good things to keep an eye on. I just want to bring it back to the guidelines one more time because this is super important. So that moderate intensity or vigorous intensity combined with resistance, throw in some stretching and balance, and then some key takeaways. So cancer survivors are at an increased risk for developing cardiovascular disease, but exercise can reduce that overall risk. And there are many things you can do to help with your symptoms and help with your overall risk factors for cardiovascular health. Exercise is safe and may mitigate cardiotoxicity. We're not 100% sure on that, but it can help to reduce that cardiovascular risk. We have those guidelines from the American College of Sports Medicine. Using RPE is a great way to determine intensity, especially if you don't have a way to track your heart rate or you're not sure if it's reliable for you. And always doing something is better than nothing. If you can get out and move even on your worst days, I promise you're going to feel better and you're going to have a better time tolerating all the treatment. Exercise, again, is something you can actually do to control, something you can actually control in your diagnosis. So you can do this to help your doctors fight the cancer. And that is everything I have. So, a couple references. Again, thank you so much for having me. This has been great. It's so fun to see how many people came today. And I'm happy to answer as many questions as I can. I'm definitely more exercise focused. So, if it's more cardiology specific, I'll do the best I can to get an answer for you if I don't know it. But yeah, I'm happy to answer any exercise questions.
That was amazing. I want to do a exercise snack right now, frankly,
Perfect.
because I
Let's
think
do
we're
it.
all motivated to go. So that was incredible, super comprehensive. Thank you so much. We had a couple questions in the chat. So just some clarity, perhaps for someone starting out, if they're looking for an exercise goal, if they're receiving chemo, is it best to lean on those guidelines that you mentioned, the 150, or should they be leaning a little bit more on those PORI guidelines that you outline on chemo versus immunotherapy? Where might you start?
And I will
Yeah,
just say,
definitely.
sorry, that was my question. I apologize.
That's
It was
okay.
actually my resting heart rate is elevated. I'm at like 90s, low hundreds. I've been walking 3 miles. I'm tolerating my chemo very well, but it
Cool.
sounds like I might need some clearance if I want to do a little bit more rigorous exercise with my baseline being at that 90s, low hundreds.
Yeah, that's an excellent question. I'm so glad that you asked that because I have several patients who also have that elevated resting. It is not uncommon to have even before chemotherapy. I would ask if you see a cardio-oncologist or a cardiologist. And if you do, I would definitely ask them just to say, is it okay that I exercise past? If you're resting like normal because you're getting treatment is higher, our cardiologist typically says, as long as you're like otherwise healthy and doing fine,
Asymptomatic and whatnot.
yeah, then we're not usually that worried about it. And
Okay.
I would just have you really monitor your heart rate with exercise, make sure it's not jumping way past, right? So looking at that RPE scale, and if you're going for more moderate, and it's shooting into like the 150s, then maybe it's a little bit too high and kind of
Oh,
slow it down.
I've been
What
in the
I'll
130s. I've been doing okay then. Oh,
Great. I
cool.
think that
Good
you're
deal.
doing just fine. Yeah.
Thank
So
you.
yeah, no, you're great. I'll have patients where I'll see them in the clinic and we'll put a chest strap on them and the pulse ox and we'll monitor their heart rate. And as long as it's kind of fluctuating in a good way and it's maintaining not overly high, then we're okay. I might have people really work on the low, just like cardio protective, don't over push it. But yeah, it sounds like you're doing fine. I would, if you don't see a cardiologist already, wherever you are with your treatment, that might be a great thing to ask your team about. Try to see a cardio-oncologist and they'll give you a little bit more guidance on, yeah, you're good, or because it's really high, maybe try to be even slower with your walking.
Thank you.
Yeah.
Amazing. Thank you. Another question we had is inquiring about the type of therapy you do for peripheral neuropathy.
Yes, I'll give a little plug on that actually, because it's been great. So we have recently been doing a massage for neuropathy, a neuropathy massage. Gosh, now because I wasn't prepared, I don't have her name, but there is a physical therapist that created this program. They looked at Thai foot massage and diabetic neuropathy and created a hands-on massage technique and protocol. And we've been seeing some pretty good results with it. You can do it to yourself. So what I'll do is I'll give Erin the information. She has a website and a couple YouTube videos on how to do it to yourself. So I'll give her that information. I'll usually do the massage at least on one foot or one hand and see how patients notice a difference. It's pretty intensive. It's like 3 times a day for 8 to 11 weeks. That gives us the best result from it. But something's usually better than nothing. It's getting some blood flow to the nerves, try to heal it. So I'll give her those information with the website and the videos. Okay.
Thank you
You got
very
it.
much. I
Yeah.
appreciate it.
Kathleen, I'll pass that along to you. Yeah, and we'll share that along with the slides.
Great.
Excellent. I love this question, another one that we have in the chat regarding exercising with osteoporosis, because I know that that is a concern that comes up quite a bit as to whether that's safe or not. What do you say about that, Nickie?
Yeah, exercise is one of the best things you can do for osteoporosis, actually. So I do want you to exercise. We want to get weight bearing through our bones. So we have a battery of exercises we use that's kind of pressing into the ground to get the long bones pressing into that. That increases some weight bearing, but walking is fantastic. So go for a walk. There's a lot of buzz about weighted vests right now. I'm not sure we have research that confirms or deny, but I'll often say, hey, it's not going to hurt you. It's trying to get more weight through our spine, and our spine is the area we're more at risk for fractures. So we wanna walk, you wanna weight bear, you wanna strength train. Any resistance exercise where the muscles are pulling on the bone actually helps to promote more strength within the bone. So yes, please exercise. It is good to get a little bit of pounding, but if you have a diagnosis of osteoporosis versus osteopenia or just more at risk for it, you do want to talk to your healthcare team and make sure it's safe for you to jog or something like that. Generally, it's pretty good. Like jumping on trampolines can be really helpful for it, but it might be good to get some guidance if you have that osteoporosis diagnosis. But if you don't have resources in your area, yes, please walk, please move, please strength train, do all the things. It's going to help with osteoporosis.
And I'm actually glad you mentioned a weighted vest, because I have asked in conversations with our Unite for Her members, I've been asked for guidance, which I do not know, on where to start. So if someone wants to get a weighted vest, like how much weight do they start with in an effort to not overdo it right off the bat?
Sure, that's an excellent question. I don't know that we have. I'll have to check in the research. I don't know if we have specifics on the amount of weight, but usually what I'll recommend is get one that's adjustable. Don't get one that's just like 20 pounds. Get something where you can add weight to it. And I have some patients start with maybe 5 pounds, and then they'll slowly add up from that as they're tolerating it more and more. So just get
Okay.
one that's adjustable and then start really small until you know your body can tolerate it.
Love that. Great.
Yeah.
Another question, which also love, a person that is on Avastin and they have that joint pain in their shoulders and arms. What are the best exercises that they can do for this issue, or, joint pain and even in other areas of body?
It's another great question. So Avastin and even all those endocrine therapy ones, often a side effect is the joint pain, which many people know. So exercise is another good thing. Strength training can be really helpful. I will say, since we're talking about cardiovascular can be helpful too, because we're getting the blood pumping, we're boosting the immune system, we're trying to reduce inflammation in the body, and that can help with our joints. But strength training, specifically around the joints that we have some of that discomfort, if it's shoulder you're talking about, posture related work, so doing some scapular squeezes, some chin tucks for posture, give yourself a nice double chin there. That's going to be really helpful to kind of keep everything in good alignment. And then strengthening the rotator cuff muscles, all of our back muscles, that can help with the joint pain. Joint pain from chemotherapy can be really tricky. It kind of ebbs and flows. Often it mimics like arthritis, where it's kind of you're stiff when you first get up, and the more you move, the better you get. There is a level of joint pain that may not totally go away, but the more active you are in general, usually the more tolerable the joint pain becomes.
Amazing. Thank you for that. Okay. We have two last questions in the chat before we wrap for the evening, if that's okay, Nickie, if you have just a
Sure.
couple more minutes.
Oh, yeah, that's all good.
Love this. Are the recommendations for exercise universal for all ages, or are there slightly different recommendations for those 65 and above?
That's an excellent question, actually. I am pretty sure that they're for all ages. We want to be as active as possible no matter where. I will double check on that though, and if there's something different, I'll give it to Erin to put in. But I'm pretty positive the exercise for older adults, but over the age of like 70, that type of deal, is going to be about the same. Maybe it's a little bit less in the intensity, but honestly, I give everyone the same because all of my patients, remember that study, patients over the age of 70 that I mentioned for breast cancer, they had an even more improvement in their fitness level and their cardiovascular risk. Those were the guidelines. So I didn't get into met hours and stuff like that. It's more used in research and a little more complicated, but the 9 met hours is 150 minutes a week of moderate intensity aerobic exercise. So my initial answer to that is no, it should be absolutely the same as the guidelines for the average American. The more you do, typically the better. We just want to slowly increase. If you're totally sedentary, we're not moving at all, please don't get up and just start walking. Maybe, I mean, you could try to walk 5 times a week for 30 minutes, but you might burn out. You might start to have a little bit of joint issue. So I'll often start people twice a week because you're going to be more compliant. So pick every Tuesday, Thursday morning, you're going to go for a walk, maybe even start 5 to 10 minutes, but then build up. The goal is that 150 minutes. So yes, definitely keep them the same.
And I love that you called that out, Nickie, that you're not the goal isn't starting off at the bat with the 150 minutes, right?
Yeah.
Being a little bit more conservative, especially if movement and exercise is new to a person,
Yep, you
and
got it.
building up to it. We're not striving to get there right from the start.
Absolutely. And that's where working with exercise professionals can be helpful. If you're kind of like, I don't really know where to start, so talking to a physical therapist, even if they're not oncology trained, they can help get you on track. And then also, like the Stronger Through Cancer, there's a lot of personal trainers that have some more exercise oncology specifics with them. So if you're not really sure where to start, it's always good to just ask for help and get some assistance.
Amazing. Okay, and then last question, massage for neuropathy. Is that good if they're experiencing that neuropathy in their legs as well? So
Yeah.
further up than just their feet and hands even.
Yeah, so I would say yes. If it is like pretty high up from the feet and you haven't had anyone look at it, it might be worth going to see, again, I'm biased, but a physical therapist, because they can rule out maybe it's something from your back. If you had a pre-existing condition in your back, like a disc disease or something like that, that's relatively common, it might be from your back kind of shooting down the leg. So we want to clear that and make sure there's nothing else going on. But if it is truly just neuropathy, yes, I had a patient who he had so many chemos, he didn't even know what they were, like 20 years ago. And he had neuropathy all the way up towards his knees. And he also had swelling and lymphedema, which I know is not what we're supposed to get into today. But we got him good compression for his legs and we did the neuropathy massage, and he now only has neuropathy in his toes. So it really, and I will
Amazing.
say, not everybody responds the same way, so it's not magic. But some people respond really, really well, especially if it's drug related. So chemo-induced neuropathy and diabetic neuropathy tend to respond best to this kind of intervention. So even if it's further up, yes, go for it. Give it a try. Follow the recommendations for it because it's easy enough to do on your own and pretty safe. I also, just as a quick note for like a functional tip for everyone, not everyone can reach their feet, and sometimes we've got joint pain in our thumbs. So protect your hands if you're massaging your feet. You can use like a tennis ball and roll the bottom of the foot on a tennis ball, and that can get some of those trigger points or knots within the muscle to help release it if we can't use the hands. So
Amazing.
that's a little bit of an aside, but yeah, you should still try it. It might help.
Great. Wonderful. Well, Nickie, this was amazing. This was inspiring and informative and helpful, and just what a thorough discussion this evening. We are so grateful for you spending your time with us tonight. This was really, really motivating, and hopefully all of us feel like we're going to step away and do a little snack tonight before we settle in.
Everyone get a little exercise snack in for me, okay? Just like 2 minutes.
We can all do it.
Perfect.
I
Thank
love
you
it.
so much for having me. This was great. It was so nice to see everybody, and I hope that I've inspired you guys to just go for a little bit of a walk later today. Enjoy
I
the
love
nice
it.
weather.
Thank you. You as well. And I know we have an additional resource coming that will post with this video recording. So be on the lookout in our UFH Connect video library, not only for tonight's segment, but some additional resources from Nickie as well. So thank you so much.
Of course. Thanks, guys, for having me.
All right, amazing. So thank you everyone for joining in and listening along. Thank you for all your questions. Hopefully this was informative and inspiring and motivating for all of us. So no matter, what type of baseline activity you have as part of your life, we can all start somewhere and everything is achievable. So hopefully we can all find a Nickie in our area to guide us through, but if not, she gave us a lot of different resources that can be supportive and informative so that we can all move safely. So thank you so much for joining. I want to give one more thanks to our amazing education sponsors this evening. So tonight's speaker series was presented by West, Merck, Lilly, Novartis, and Gilead Sciences. Additional support from gold sponsors of Pfizer, GSK, and Daiichi Sankyo. And we have additional support from our supporting sponsors, AbbVie, Tercera Therapeutics, and Veristem Oncology. Don't forget to join me next Thursday, September 25th, 1 p.m. We will be chatting with our partners at Okra for Ovarian Cancer Awareness Month. So be sure to join me live on Facebook and check out our UFH video library for all recordings of our segments. We've had a lot of activity in September alone. I popped the link to our cardio oncology segment we've done in the past. We've covered a lot of topics. So if there's something else that you are looking for, chances are we've talked about it. So be sure to check that out. But otherwise, thank you so much to everyone for being here. Kristen, thank you so much for joining me and helping along. And I hope everyone has a really great night, and we'll see you again soon.